Now I'm going to show you how to do the ventilator patient check. Of course, I'm going to walk in my patient room, get gloved or sanitized and gloved because I'm going to be checking the patient over, assessing the patient, assessing the vitals. Then I'm going to come over to, of course, introduce myself first to the patient and family, if there's any family in the room. So then I would assess them. Then I'm going to go fill out my sheet, which today is the 28th, so I put my date, put the time, 11:24. I put my initials, the mode the patient's in, and there's a big glare on this. So they're in PRVC. There's no pressure. The machine tidal volume is the 396, or 400, which is what we're set at. Which I'm not going to have spontaneous since I'm using chest lung, but if there's a value below or above that value, I'm going to write it down in my spontaneous rate. So it's spontaneous volume, which I already did. So the machine rate is set to 12. My spontaneous rate, if the patient's breathing anywhere above the ventilator, then I would do that, which I'm not going to have any on this, so I'm going to put 0. My minute volume's in this corner, so I can write it down, which my FiO2 is 100%, being that I only have one air supply, I have to run it on a 100%. My PEEP is 5. My peak pressure is 22. 22. My eyes are crossing when I look up. Okay. So my IE ratio is 1:4. My dynamic compliance I can also find on my vent. It's I have to push next page twice and it'll give me, which it's at 21. I'd look at my CO2 monitor for my end-tidal CO2, and I'd place it right there. I'd look at the patient vitals now, because it's SpO2, let's say we're at 98, heart rate 70, 120/80, and then I would say if I suctioned the patient, and because you would assess to see if you needed to suction them, of course. So let's say I don't have to suction that time, I would just put an X there. I've already assessed them, so I heard my bilateral breath sounds. I would check my alarms, make sure they're on and working, and then I would check my check my alarms. This is what I want. I could add the patient if I wanted to. Cancel. There's that. Oops. Cancel. I would check of course, my limits too. So I just showed you how to get there. My alarm profile is this button. Then I would look at my alarms. My high pressure alarm is 40, so I'd write 40. And on here you can't set a low pressure, so it doesn't have any. So I'd do that. And when I was assessing the patient, I would also look at the ET tube size, the level at the lip, and this side is if I've made any changes today, if the doctor's made a change, they would write it here and sign it. Of course, I would sign it. I would also put what my initial parameters are, so just the settings on the vent that are set right now. If I've changed any equipment, I'd put it here. I'd put the treatments the patient's receiving, what their diagnosis is, what vent day they're on, and the vent number, which this one is Servo 6. So, do all that. I would sign and date it and put the shift, because here we do vent checks every 2 hours. I actually had them walk me through a vent check yesterday, so I would know how to do it, find what I needed. And then after you're done, you just